Hello, everyone. My name is Devan Desai, and I'm an incoming third-year student here at Duke University. This summer, through the Margolis Summer Internship Program, I work with Dr. Christine Gertz in order to look into ways on how we can reimagine spine care in the Duke University health system, with a specific focus on managing and treating low back pain. So to introduce low back pain, it is the most commonly reported pain condition in the United States. And in 2017, a CDC study showed that over just a 3-month period, close to a quarter of American adults reported having acute low back pain. And beyond acute low back pain, there are 3 other types. So low back pain combined with neck pain is cited as the highest spending cost in the American healthcare system, with a yearly price tag of over $134 billion. And while acute and subacute low back pain may be solved with early conservative treatment, other types of low back pain may require longer recovery time. In 2018, the Duke University Health System reaffirmed their commitment to improving spine care and low back pain treatment through new strategic goals. Under the name of the Duke Spine Health Program, there are a variety of initiatives that are being used currently in order to deliver the best treatment from the best provider at the right time. There's also an effort to promote and enhance non-operative care options, as well as treatments that normally cost lower than treatments that are used to help patients. And on the right, you could see that Figure 1 shows an overview of the Duke Spine Health Program and how it leverages different types of treatment in order for each patient to have a really good individualized care experience. So now that we've introduced low back pain, this summer I worked on supporting the Duke Spine Health Program through a variety of different projects and initiatives, one of which was developing clinical care pathways. So clinical care pathways and developing them actually takes a very multidisciplinary process. And here at Duke, a steering committee of healthcare professionals from different disciplines will come together for this process. Their goal is to identify gaps in current care and develop evidence-based, patient-centered recommendations in order to help patients with low back pain. And after completing these pathways, the pathways will actually serve as a very powerful tool for providers in order to leverage the best clinically proven practices and treatment options. So in my research, I conducted a literature review of different low back pain guidelines, and after applying different criteria, I arrived to a final list of 23 guidelines. I made sure that the guidelines that I was looking at were all published within the last 5 years, so from 2016 to 2021. The reason for this is that when a guideline is published, it reflects the state of evidence at that time. And over the years, new studies will come out and new evidence will actually even change some of the recommendations. So different organizations will actually continuously update their recommendations on low back pain to be current and make sure that they're providing the most accurate recommendations. So to the right, you could see that I've created a table of 6 of the different clinical guidelines that I looked at, as well as their recommendations. I separated their recommendations into pharmacological and non-pharmacological categories. And what you could see is all of these different guidelines present the recommendations on different strengths of evidence. So what this means is that some of the recommendations are very strong, but there's also a few treatments that have moderate evidence or weak evidence that support them. There's also one guideline that had a consensus-based recommendation. And what that means is instead of looking at randomized controlled trials or other studies, they just looked to see what the other guidelines were recommending and then made their own recommendation for that particular treatment. And what you could see in this table is that I've also used different identifiers in order to indicate whether a particular recommendation was supported, not supported, or had a variety of different other recommendations. So beyond developing clinical care pathways, I also worked with the Value-Based Spine Program, or V-Spine, in their work. So this new program facilitates either in-person or web-based telehealth visits in order to connect patients to doctors of physical therapy or chiropractic. And the goal of this program is to use evidence-based treatment options to have the best outcome for patients. And this graphic is actually used on different patient and physician education documents, and it has been provided by Dr. Ren Burton. So beyond the development of clinical care pathways in V-Spine, there are also other programs taking place within the Duke University health system. One of them is the implementation of the American College of Physicians guideline for low back pain, or the IMPACT LBP NIH-funded study. So this study is actually being conducted jointly between the Duke University health system and health systems at the University of Iowa and Dartmouth College. And they have three main goals, which are listed below. And essentially, they're trying to study the effectiveness of different types of models being used in order to help patients suffering from low back pain. Finally, one other program that I would like to highlight is the Care Redesign Project. And the Care Redesign Project is developing and implementing different patient advice and skills training so that primary care physicians can use guideline congruent or guideline supported care for neck and low back pain. And this project is being done at 3 different Duke primary care clinics. So this summer, I was able to contribute to a variety of different projects within the Duke University health system that all support spine and low back pain. So the 4 projects that I worked on were the Care Redesign Project, Clinical Care Pathways, contributed to the NIH grant, as well as the V-Spine program. And what figure 3 on the right shows is that all of these different initiatives are being put together in order to create a puzzle of the best treatment plan for different patients within the Duke University health system. And what this means is that when a patient comes in for low back pain, the system instantly knows their best plan of attack in order to help patients improve and eventually be treated from their pain. And work is ongoing on this project, and I'm just grateful for the opportunity to contribute to this incredible initiative here at Duke. And this work would not have been possible without the support of the Margolis Center for Health Policy. I would also like to acknowledge 2 different groups that were very essential to my work, and they are the Duke Spine Health Steering Committee and the Spine Healthcare Redesign Team. Additionally, a full list of the references that I've used in this poster can be found by scanning the QR code to the right or by clicking the link below. So that concludes this presentation, and thank you so much for listening on different ways that the Duke University health system is trying to manage and treat low back pain. Thank you.